NCLEX-RN Deep Dive. Crack the exam with confidence. Hi everyone! Today we're going to talk about the next generation NCLEX or NGN. We'll go over what it is, when it's going to be released, and we'll go over the 5 question types that you will see on this exam. So what is the NGN? This is a computer-based adaptive testing system. It's going to replace the paper-based exams that we currently have. The biggest thing about this new NCLEX is that it's adaptive. That means that the questions that you get are going to be based on your knowledge and your ability. So if you answer a question correctly, you're going to get a harder question. If you answer a question incorrectly, you're going to get an easier question. The other thing about this exam is that it's going to be longer. You can expect between 75 and 265 questions. That's a huge range. The current NCLEX is between 70 to 90 questions. The good news is that the 5 question types that are on the NCLEX currently are going to be the same ones that are on the Next-Gen NCLEX. So those are select all that apply. Hotspot, fill in the blank, drag and drop, and extended multiple choice. Let's go through the hotspot questions. These are the questions where you're going to see like a graphic and it will say, point to the area where the pain would be. So these are very similar to the current hotspot questions that we have right now. Then there's going to be matrix questions. These are also very similar to the ones that we currently have on the NCLEX. You're going to see a chart, and it's going to ask you to do a comparison of different things. Then there's going to be case study questions. These are very similar to the case study questions that we have right now, except for these are going to have graphics. So you're going to need to be able to interpret the graphics, the charts, the graphs, things like that. Then there's going to be extended multiple choice questions. These are also very similar to the ones that we have currently. These are just going to be longer. They're going to have more options. You're going to have to read a lengthy paragraph before you answer the question. And then finally, there's clinical judgment and prioritization questions. These are new. They're not something that you're going to see on the current NCLEX, and these are going to require you to use your knowledge and your experience to make a determination. So these are going to be very similar to the type of questions that you would see on the boards. So make sure that you have a good understanding of your medical surgical nursing, your obstetrics, pediatrics, your psych, your pharmacology. All of those are going to be fair game for these types of questions. And my tip for you on how to answer these questions is to always start with the patient. So look at the patient first. Determine what's going on with them. What are their priorities? What do they need? And then determine what your plan of care is going to be based on that. If you found this helpful, please like and share it and let me know what questions you have in the comments below. I'd love to help you out.